The medical charity Médecins Sans Frontières, or Doctors Without Borders, has condemned the deliberate and widespread attacks on healthcare facilities in Ethiopia's restive Tigray region, which faces collapse of health services following months of military conflict. According to MSF, only 13% of 106 health facilities are functioning at normal capacity. The majority have been looted, vandalized and captured by soldiers. MSF Director General Oliver Behn has called on all parties to respect protected status of medical centres and health workers from violence. The conflict in Ethiopia's Tigray region erupted in November last year when government launched an offensive to oust the Tigray People's Liberation Front after its fighters captured federal military bases in Tigray. About 2.2 million people have been displaced, and Prime Minister Abiy Ahmed has been accused of failing to bring peace, address the political wrangling within government and recurring ethnic conflict. Well, to give us an idea of what's been unfolding in Tigray is Oliver Behn, who's the Director General for Doctors Without Borders, Médecins Sans Frontières. He's on Zoom from Holland. Thanks very much indeed for joining us. Welcome to the program.
Thank you very much for having me. It's a great pleasure to be here.
All right, so your team visited over 106 healthcare facilities. What did they find?
So I've been also just coming back from Tigray, so a couple of days back. And I was in Shire, which is in central Tigray, and also in the surrounding, in some of the villages, and I saw firsthand myself the destruction and the looting of the health facilities. But overall, we saw health posts, health centers and hospitals being damaged, looted, vandalized over the past 4 months. We have seen over 106 facilities in this period. And to describe the vandalization a little bit, you have to imagine that you're walking into a room that is 3 by 4 meters, full of shelves until the ceiling, where normally all the drugs are stored, the medical supply is stored, and all the jars, where the drugs are inside, they are opened, and all the pills are thrown on the floor, all the vials are thrown on the floor, the cold chain for the vaccination for the newborn is destroyed, patient files are thrown around, laboratory equipment is intentionally destroyed, so you can't use it anymore. And you go from room to room where you see this destruction and this malicious vandalism, I would call it, and the rage against that. And but we also have seen, of course, we have seen health facilities or hospitals that have been occupied by the Eritrean or by the Ethiopian military. We have seen ambulances that have been taken by the military and used for transport of goods and people. And all of that, of course, has a catastrophic impact on the health for the population that you already described, displaced people and people where conflict is going on since 4 months.
All right, so let's look at the vandalization and the looting. What are they stealing from these hospitals?
Well, it depends on, sometimes in some health centers, the one where I was, there was practically nothing stolen. Everything was still there. It was just destroyed. But we also have seen in other health facilities how some of the equipment was taken away, beds, some of the machines. Often what has been taken and what has disappeared are the computers and some of the electrical equipment. But the medical equipment, by and large, is still there. It's just destroyed.
And then in terms of the vandalism, how would you describe it? Is it opportunistic or is it deliberate sabotage?
I mean, if you think about that, over 100 facilities have been damaged or that we have seen. 70 of them have been damaged, looted or vandalized. Only 10-15% are functional of all the health facilities. Now, if you think about such a high number of over 70 that have been vandalized or damaged, you wonder whether all of that is opportunistic, whether that is all about going after some spoils of a conflict, that he can turn into something. And you wonder why it is only destroyed and nothing has been taken. And therefore, I think it's for others to really answer these questions. We are only describing what we are seeing. We are not a political organization or a human rights organization. We are a medical organization coming to health centers where we see the equipment is still there. It's destroyed. The supplies are there, but it's unusable.
It's difficult, I guess, to pinpoint who exactly, but it must be a concern that soldiers, Eritrean troops as well, are present in some of these facilities. What are they there doing?
I don't know. In a way, I'm not sure, because we have, of course, seen that, but we are not necessarily then in contact with them. So that I wouldn't be able to comment on that.
All right, let's talk a little bit about the consequences of this. I mean, a few months before, this region enjoyed perhaps one of the best in terms of healthcare facilities, and that's all but been destroyed in a short period of time.
Yeah, no, I think it's really, it's heartbreaking and it's sad. It's not only that such a fantastic health system that has been built up in Ethiopia. We can see this now also when we are working there with health workers and with the population. The health literacy is so high. People know exactly what they need in order to stay healthy. But what is now not existing anymore is for women to have consultations when they are pregnant, to identify high-risk pregnancy, and to have the appropriate antenatal care visits, the pregnant visits when you're pregnant, but also when there are complicated deliveries. The ambulances are not existing anymore, which means we know about women who died at home with complicated deliveries, which normally would have been not a problem to visit health centers. People who have chronic diseases, tuberculosis, HIV, have no access to their medication anymore. The vaccination of the newborn has stopped since early November, and the whole cold chain, what you need for the vaccines, has broken down. Survivors of sexual violence have no access to medical care, psychosocial support services. So the impact are very acute now, but also you will see this over a longer time period, even, when the repair will start and the recovery will start at one point. It will still have a long impact. And of course, the health workers, they're afraid, they have been threatened, they have left. Most facilities have no health staff anymore. So people also need to return. So it's quite a complex situation for the population, who is in hiding, many of them, or in displaced camps.
And I would imagine with some healthcare facilities completely decimated, that means the citizens have to travel even further to access any kind of healthcare.
It's traveling far, and then when you arrive, it's overcrowded. The services are not fully functioning. So we are running out of the cities. We are running mobile clinics or outreach clinics, as we call it, which means we go with 2 Land Cruisers and a team of 10 people. We drive sometimes 1.5 to 2 hours to come to a rural area, to a village, where we provide comprehensive medical services. People there, and I've been there myself, and I've talked to people, they're living in hiding, and they walk 1 to 2 hours to come to the village on that day when we are arriving to seek health care. And then they go back into hiding again, into the mountains and into the wilderness, because they're not yet ready to come back into their villages also.
And I can imagine, I'm thinking about children now and standard vaccinations. If those are not delivered, we're already looking at a problem in the future, aren't we?
Yeah, we haven't seen yet any outbreaks of measles, for example, but we're of course very concerned, and we're working also very close as we can with the Ministry of Health, what is possible, to help with the vaccines and to help to transport the vaccines and also to start vaccinate the children again. But there's a huge gap, of course. As I explained, since November, there's no vaccination happening anymore, so you need to catch up with the vaccination. All of that needs needs to happen, which is not fully possible at the moment, also because there's still fighting going on and insecurity.
With the continued fighting, are you seeing healthcare facilities continuing to be damaged, vandalized, or has that stopped for the time being?
Well, we still know that some of the health facilities are occupied by Eritrean military. And we have seen still some of the looting that is happening, but it's not so much anymore, is our feeling. I think a lot of the damage has been done, but it's also still, we're still discovering new villages and new communities, and therefore we're still finding also new facilities that are destroyed, and that we are starting to slowly rehabilitate as we are coming there.
If urgent action isn't taken, what do you foresee might happen in the region?
Well, there's a couple of things. One of the things is the rainy season will soon start in June. Before the rainy season, the fields need to be prepared, and the planting is starting. The people that I've talked to, and I've talked to many families, many of them don't have their seeds anymore. They have been eaten rather than being kept in order for the planting, which means the whole planting season this year will probably be very, very small. The rains are coming, which means people need appropriate shelter. People are living in the displaced camps, many without appropriate shelter. Many are in hiding in the forests and mountains. So I think we could see quite a difficult situation in terms of nutrition crisis coming towards us. At the moment, the nutrition levels are not alarming, but we are seeing more and more moderate and severe acute malnourished children coming to our centers. So the numbers are going up, and the situation will only get more difficult. So food is important, nutritional service is important. People in the displaced camps or in these sites, they need appropriate space. It's totally overcrowded. Protection is important for the people, for safety. And I think also what is important, I think the international humanitarian community has not yet lived up to the level of the crisis. I do think that the United Nations and other organizations need to scale up their responses. For us as MSF, this is one of our biggest responses now that we have worldwide. And I'm not sure that everybody sees it the same way. And I really hope that others recognize the urgency of the situation. Over 1 million people are still without aid. And as you mentioned, over 2 million people are depending there on acute relief. So this is a large-scale emergency that is going on there with too little actors.
I know the work of MSF can only happen with the cooperation of the home countries in the areas that you go to. How are the Ethiopian authorities assisting with what's happening in Tigray? Have they helped you to get access and perhaps start doing some necessary work there?
So we are in Tigray since early November. It started with that we started to treat hundreds of people that came to our health centers that were wounded, civilians, and our people who were affected by directly combatants. So we treated hundreds of people early November, and since then we are working in Tigray. In Shire, in central Shire, we are since early January, and in the eastern part we are also since mid-January. We, as an independent and neutral organization, so we are talking to all parties in the conflict. So we are talking to everybody who is in Tigray or who is involved in the conflict. We are providing impartial medical assistance for a population without any second agenda. And all parties in the conflict, all armed actors in Tigray are recognizing that. And so we have pretty much unhindered access. So we can go everywhere. We have been everywhere. And we talk to everybody. And everybody facilitates us at the moment as good as they can.
Oliver Behn, we're going to have to leave it there, but thank you very, very much indeed for giving us your time and sharing this story. Let's hope that those that can assist urgently, particularly at the United Nations level, can intervene, because as you've described, this certainly is a sad catastrophe that's playing out. Thank you so much for your time.
Thank you for having me, and thank you for airing this.